Hi, today we are going to see a topic which is seldom touched by nurses, but a very important topic in nursing: concept and theory development. Without nursing theory, nursing activities and interventions are guided by tradition or they are simply random. Theory development in the past was to clearly establish nursing as a profession. Presently, these theories guide nursing practice, nursing research, nursing administration, nursing management, and nursing education. In one of our another video, we have seen the classification of theories. Kindly go through that video so that you will be understanding how theories are categorized. In nursing, theories are systematic explanation of events in which constructs or concepts are identified, relationships are proposed, and predictions are made to describe, explain, predict, or prescribe practice and research. Theories are not discovered. They are constructed or developed to describe, explain, or understand phenomena or solve problems. Theories help organize existing knowledge and aid in making new and important discoveries to advance practice. Theory development is a complex, time-consuming process that covers a number of stages or phases from inception of concepts to testing of theoretical propositions through research. Theory development helps the nurse understand practice in a more complete and insightful way. Theory construction, theory development, theory building, and theory generation, all these terms are used interchangeably. Now let us see what are the components of a theory. There are 6 main components we will be seeing in theories, starting with the purpose. Purpose explains why the theory was formulated and specifies the situations in which the theory should be applied. Concepts and definitions. Concepts are linguistic labels that are assigned to objects or events and are considered the building blocks of theories. Operationally defined concepts link the concepts to the real world, and these operationally defined concepts will permit observation and measurement of the concepts. Theoretical statements. Once a concept is fully developed and presented, it can be combined with other concepts to create statements to describe the real world. The theoretical statements or propositions are statements about the relationship between two or more concepts and are used to connect concepts to devise the theory. This development of theoretical statements introduces the possibility of analysis. There are two types of theoretical statements: existence statements and relational statements. Existence statements are statements that claim the existence of a phenomenon, and relational statements are theoretical statements that describes relationship between concepts. The fourth component of a theory is structure or linkages and ordering. The structure provides overall form to the theory. Theory structuring includes determination of the order of appearance of the relationships, identification of central relationships, and delineation of direction, strength, and quality of relationship. Theoretical linkages offer a recent explanation of why the variables in the theory may be connected in some manner. Conceptual arrangement of statements and linkages lead to hypotheses, further leading to the testability of the theory by specifying how the variables are connected. Assumptions are notations that are taken to be true without proof. Assumptions cannot be empirically tested, but they can be argued philosophically. Assumptions of a theory are based on what the theorist considers to support the propositions, based on accepted knowledge, or it can be based on the personal belief of the particular theorist. Assumptions may be factual, that is, that are known through experience, or it can be reflecting personal, or it can reflect value positions, that is simply what is right or good or ought to be. Conceptual models. They are schematic representations of some aspects of reality. It specifies relationship among variables in a graphic form. Using the conceptual model, a person should be able to explain what happened, predict what will happen, and interpret what is happening. Once a conceptual model has been illustrated, the phenomenon represented can be examined in different settings, testing the usefulness and generalizability of the underlying theory. The first important thing in theory development is concept development. First we will see in detail what is this concept development, then we will go through the steps of theory development. The process of developing, clarifying, comparing and contrasting and integrating well-derived and defined concepts. They are necessary for theory development and to gauge research studies. So concepts are the building blocks of theory. The development of concepts are the most important part of theory development. A nurse who desires to examine or study a phenomena in depth has to start by defining the phenomena or concept. The concept development or concept analysis serves as the basis for the development of conceptual frameworks, theories, and research studies. Clarifying, recognizing, and defining concepts that describe a particular phenomena is the purpose of concept development. Concepts are terms that refer to phenomena that occur in nature or in our thought. Concept may be abstract, that means in our thought whatever things are there. Example, hope, love, desire. Or concept can be concrete, that is what is occurring in nature, we can see and feel. Example, airplane, body temperature, pain. Concepts give meaning to a phenomena. A concept may be a word, for example, grief, empathy, power, pain. Concept can be two words, for example, job satisfaction, need fulfillment, role strain. Or concept can be a phrase, for example, maternal role attachment, health promotion behaviors. When operationalized, these concepts becomes variables and can be used in hypotheses to be tested in research. Concepts can be compared to bricks in a wall. Constructing conceptual meaning is a vital approach to theory building. A concept should have a meaning. Formal study of concepts enhances knowledge development for nursing through naming, creating, and confirming the phenomena of interest. Conceptual meaning is created by scholars and researchers so that their readers thoroughly and accurately comprehend their work. In nursing, concepts have been borrowed from other disciplines. For example, adaptation is a concept which is borrowed from other disciplines as well as developed directly from nursing research and practice. For example, the concept maternal-infant bonding. Categorization of concepts. The first category is concrete concept. Concrete concepts are simple and directly observable, can be seen, felt or heard. For example, a chair, color red, jazz music. Abstract concepts are not clearly observable and must be defined in terms of observable concepts or concrete concepts. For example, self-esteem, social support, personality, role. Then there is continuous or variable concepts, that is there is a continuum for the dimension, blood pressure, pain. Then there is discrete non-variable concepts that fit into a predetermined category, has a particular dimension. For example, pregnant or non-pregnant. Means people will come in one category. Religion categories are there. Marital status categories are there. Another classification of concept is theoretically defined concept. That means the concept get a meaning from the theory. An operationally defined concept describes a set of procedures that will be performed to assign a value for the concept. This allows hypothesis to be tested. So there in operationally defined concept, a value can be given for the concept. Let us see this theoretically defined concepts and operationally defined concept with an example. Health risk behavior, it is a concept. When it is theoretically defined, it is unhealthy lifestyle choices such as smoking cigarette, drug abuse, alcohol abuse, exposure to violence and unhealthy dietary behaviors. Then health risk behaviors, how it can be operationally defined so that we can assign a value. Score on the Youth Risk Behaviors Surveillance Questionnaire. So this is how a concept can be theoretically and operationally defined. Concept analysis can be used in the development of nursing concepts by following certain criteria. So every concept which is developed should be analyzed. It will identify the gaps in nursing knowledge. Concept analysis helps identifying where is the gap in nursing knowledge. Determine the need to define or refine or clarify a concept when it has multiple meanings. Evaluate the adequacy of competing concepts in their relation to other phenomena. Which concept is correctly fitting? We can identify through concept analysis. Examining the congruence between the definition of concept and the way it has been operationalized, whether the two, the theoretical and operationalized concept are matching or not. Determining the fit between the definition of concepts and its clinical application. All these things can be achieved through the concept analysis. Contest for concept development. First, when we are understanding a concept, when a nurse is working in the clinicals, she may come across certain phenomena and she will be first naming the concept. The first contest for concept development is concept naming. This is the most elemental method for identifying theoretical phenomena. When talking among peers, nurses will develop a term, a word, or a phrase as a name for clarifying a problem. So that is concept naming. Isolating the concept from other concept by taking note on the context in which the concept occurs. Thus the concept is developed. We are understanding the context in which that particular concept has occurred. Once concepts have been identified, named and developed, the nurse will test them in descriptive studies. Mostly qualitative studies will be done for further developing the concept. Conceptual frameworks are formed. These are the structures that relate concepts together in a meaningful way. Researchers relate the concepts together into structures and that are called models and theories, and develop testable relationships called hypotheses. Nursing research, theory and practice, all three are related. It is like a cycle. Hence, poorly defined concept may lead to faulty construction of research, instruments and methods, which will directly or indirectly affect the practice also. Strategies for concept analysis and concept development. Many nursing scholars have developed different strategies for concept development. But today we will be just discussing the strategies which is developed by F.F. Mellis in 2012. There are three strategies for concept development according to Mellis: concept exploration, concept clarification, concept analysis. Concept exploration, the first step. It is used when concepts are new in a discipline or when a concept from another discipline is being redesigned for use in nursing. There are a number of steps in concept exploration. We are exploring the concepts. So first is identifying the major components and dimensions of the concept. Then we are raising appropriate questions about the concept, when it will happen, how it will happen, all these things we will be questioning. Then proposing triggers for continuing the exploration. We are again exploring the concept. Anything new we will be able to get. Identifying and defining the advantages to the discipline of continuing the exploration of this concept, whether there is some advantage to our nursing discipline if we are exploring this particular concept or not. These are the steps in concept exploration. We are exploring deep whether we need this particular concept or not in our discipline. Second, concept clarification. It is used to refine the concept that have been used in nursing without a clear, shared and conscious agreement on the properties of meanings contributed to them. We are trying to refine the concept. It is a way to refine existing concepts when they lack clarity for a specific nursing endeavor. Process involved in concept clarification are: clarify the boundaries of the concept, including what attributes should be included and what should be excluded when we are talking about a particular concept. For example, you think of Orum's self-care model, that self-care concept. What are the boundaries we have to keep for that self-care? Critically review the properties of the concept. Bring to light new dimension that has not been yet considered by anyone else. Compare contrast, delineate and differentiate these properties and provide examples of this concept. Identify assumptions and philosophical basis about the events that trigger the phenomena and propose questions from a nursing perspective. When concept clarification is done, we have to identify the assumptions, correlate with the assumptions also, whether it is fitting to that, and question whether we are dealing with this concept in our nursing field or not. This is concept clarification. First is exploration, then clarification. Third one is concept analysis. The goal is to bring the concept close to use in research or clinical practice and to ultimately contribute to instrument development and theory testing. So these are the three strategies in concept development. Melee process for concept development. So strategies are different. Now the steps or process are different. Now we are seeing the Melee's process for concept development. There are certain processes in concept development, starting defining. We have to first define the concept. Then we have to differentiate. Then we have to delineate the antecedents. Then delineating the consequences. We need to do modeling, analoging, and the last one is synthesizing. The first step, defining of a concept, creating theoretical and operational definitions for the concept that clarify the ambiguities, enhance the precision of the concept and relate concept to empirical reference. So first we are giving definition for the concept we have identified. The second step in process of concept development is differentiating, sorting in and out similarities and differences between the concept being developed and other like concept. We are sorting out, we are differentiating. Third one, delineating the antecedents. That means we are defining the contextual conditions under which the concept is perceived and expected to occur. What are the conditions in which this concept will happen? So that is, we are delineating the antecedents. Then we are delineating the consequences, means what will be the result of this particular concept. If it occurs, what happens? We are defining events, situations or conditions that may result from this particular concept. Next is modeling, defining and identifying exemplars, that is clinical reference or examples or research reference we are trying to find out to illustrate some aspects of the concept. Models may be same or like models or contrary models also we will be taking to find out the examples, modeling. The next step is analogizing. So here we are describing the concept through another concept of phenomena that is similar and has been studied more extensively. This concept we are trying to describe it through another concept which is similar. Last is synthesizing, that is bringing together findings, meanings and properties that have been discovered and describing future steps in theorizing. So last is synthesizing. They are here in this step we are bringing together all the findings, meanings and properties of the particular concept so that it can help in the development of a theory. Good concept development will ultimately benefit practice. So concept development is very much important when we are doing a theory development. Next, moving on to theory development. So the concept development was just a part of theory development. Now we will see how to develop a theory. For the process of theory development, nurses have to examine three vital factors. These three factors are very important. The nurses need an understanding of the relationship among theory, research and practice. It should be recognized by the nurse. Second, the nurse should be aware that there are various approaches to theory development based on the source of initiating, whether the theory is developing from practice or it is developing from a theory or it is developing from a research or not. So there are various approaches to theory development. The nurse should be aware of that also. The third thing the nurse have to understand is the process of theory development. We will see all these three vital factors one by one. First is understanding of relationship among theory, research and practice. We know that the relation is like a circle. All three are interrelated. If we are talking about the relationship between theory and research, research validates and modifies theory. In nursing, theories stimulate nurse scientists to explore significant problems in the field of nursing. So, this theory and research are interrelated. Also, when empirically tested, the results of research can be used to verify, modify, disapprove or support a theoretical proposition. Next, relationship between theory and practice if we are telling. Theory guides practice. Likewise, through practice, nursing theory is shaped and guidelines for practice are evolved through theory. Third, if we are seeing the relationship between research and practice, research is the key to the development of a discipline. Middle range and practice theories may be tested in practice through clinical research. There is a need to encourage nurses to test and refine theories and models to develop their own personal models of practice. Moving on to the approaches of theory development. It's also given by Malaise in 2012. There are four approaches to theory development. One is theory to practice to theory approach, practice to theory approach, research to theory approach, and theory to research to theory approach. We will see the approaches one by one. Theory to practice to theory. The theorists begin with the process of theorizing by first selecting a non-nursing theory. Then the theorist will use it in practice. And then during practice some refinement of the particular theory will happen. Then theory is developed. It is used when the theory's assumptions are not completely congruent with the assumptions of our nursing. So some part it is congruent, some is not matching with our nursing profession. So theory needs some modification. And the theory is not entirely useful in helping nurses to meet their goals in nursing practice if it is directly used. If some modifications are done, it may help in a practice better. The focus of the theory is different from the focus needed for nursing practice. The non-nursing theory may not be focusing on the nursing practice. The theory does not provide adequate definitions of the central concept of nursing. So it has to be implemented in practice. then it has to be again revised. So what the nurse do is the nurse modify the concepts and consider the relationship between concepts that were not in original theory. We will see the basis for development, the type of theory we will be using, and the method for development, how to do this theory to practice to theory. So what is the basis for development is an existing theory, usually a non-nursing theory was there, but it can help describe and explain a phenomena. But the theory is not complete and or it is not completely developed for nursing. So at that time the theorist felt there is a need to develop the theory. So mostly the type of theory we will be using is a borrowed or shared theory at that time. The method we will use is first the theorist selects a non-nursing theory. The theorist will analyze the theory, define and evaluate each component, then redefine using practice, redefines assumptions, concepts and propositions to reflect nursing. So this is theory to practice to theory. Example is Dreyfus's model of skill acquisition. This theory was a non-nursing theory which was used by Benner to describe novice to expert practice. Second is practice theory. These theories are inductively developed from clinical practice situations. So they are built, this practice theory, how it is built is, theories that exist are not useful in describing the phenomena of interest to the particular theorist. And there are resources to support the process of developing theories. And the phenomena is significant enough to develop knowledge and supported by present imperatives or thorough reflection about breaking new future ground. So at that time the theorist will feel to develop a new theory. Nurses may be viewing and clinical understanding of phenomena, but that understanding has not been articulated into a meaningful theory. So how to do this practice theory? The basis of development. Existing theories are not useful in describing the phenomena of interest or theory is derived from the clinical situations at that time. This development of theory is by grounded theory. The method of development is researcher observes the phenomena of interest, analyzes the similarities and differences, compares and contrasts responses and develops concepts and linkages. This is how through practice theory is developed. Example, situation-specific theory of Caucasian cancer patients' pain experience was developed through a grounded theory research. From practice, the theory was developed. Research to theory method. Developing theory from research requires knowledge of the nursing discipline, its mission, its perspective, philosophical view of science, and knowledge of various theoretical perspectives. So a thorough understanding of the knowledge of the particular discipline of nursing will help in the development of theory. We will see how to do this research to theory method. The basis of development. The development of theory is based on research. Theories evolve from replicated and confirmed research findings. So many researches we will be doing, and from the replication of the research and confirmed research findings, the theory will be developed. This type of theory development is known as scientific theory. The methods of development is the researcher first select a common phenomena. List and measures characteristics of the phenomena in variety of situations. The researcher analyzes the data to determine if there are patterns that need further study, and formalizes patterns as theoretical statement. From research, by the conduction of so many repeated researches, theory is developed. Adolescent support model, it was developed following 3 research studies comparing the nurse's perspective with the pregnant adolescent's perspective to enhance adolescents' breastfeeding experiences. So this model was developed after so many researches. The fourth one is theory to research to theory strategy. Earlier one was research to theory strategy. So there was not theoretical basis. So here in this theory to research to theory strategy, a theoretical basis is there before conduction of the research. Theory drives the research question, and the results that answer these research questions inform and modify the theory. So the difference between the previous one is here there is the usage of theory. Theory to research to theory strategy. The basis for development is theory is first there that drives the research question, and the result of the research informs and modifies the theory. So this type of theory is known as theory testing. The method for development is first the theorist define a theory and determine propositions for testing. Then research is conducted. The theory is modified, refined or further developed based on research findings. In some cases, a new theory itself may be formed. Not even refining, a new theory may be formed through theory to research to theory strategy. So these are the 4 strategies of theory development. Example of this theory to research to theory strategy is theory of genetic vulnerability, which is developed from Roy's adaptation model. Process of theory development. We need to understand different steps of theory development. First, concept development is there, which we already have discussed. Then after the concept is developed, we will go for a statement development. Third one is theory construction. Fourth one, we will be testing the theoretical relationship. And fifth one, application of theory in practice. First, concept development in detail we have discussed, that is specifying, defining and clarifying the concepts used in a phenomena. Statement development is formulating and analyzing statements explaining the relationship between the concepts. So a statement is formed which explains the relationship between concept and also involves determining the empirical reference that can validate the statement. Third is theory construction, structuring and contextualizing the components of the theory when this particular theory has to be applied. How to structure it using the concepts and relationship. Includes identifying the assumptions and organizing linkages between and among the concepts and statements to form a theoretical structure. Fourth is testing the theoretical relationship, validating theoretical relationships through empirical testing. And last is application of theory in practice, using research methods to assess how the theory can be applied in practice. The research should provide evidence to evaluate the theory's usefulness. So these are the steps or the process of theory development, which is given by Chin and Kramer in 2011. When we are dealing with the concept and theory development, we need to understand what are the barriers to theory development, because this is the reason why theory development is not happening at present in nursing. The first barrier is human barrier. Nurses as nurses. The educational system in nursing during the past. At that time, nurses were found more dependent on the medical and hospital system than on the nurses' problem solving abilities. It was not at all considered. The critical thinking was never reinforced. So what we have to do at present is we have to encourage the critical thinking in nurses, and they should be encouraged and told that nurses are also a source of knowledge. They can also develop their discipline. Human barriers. Nurses as women. In the past, theory development had sex role stereotyping. Women were less vocal in confronting their intellectual claims. There was a myth that the women they are unable to think theoretically and to develop theories. So that myth nowadays is moving away. The third human barrier is nurses as theorists. The interdisciplinary battles between the nursing service and education side is also a barrier to theoretical development. Both the service side and education side has to collaborate together in the development of theories to prevent that barrier. Knowledge barrier. Nurses had few role models. Nurses with doctoral education often neglect this theoretical nursing. That's a barrier. Theorists who are also developing these theories usually spend a great deal of time and energy justifying their theories. Rather, they should make more efforts to make the theories more clinically useful. And also there is decreased number of dissertations on nursing theories. So what can be done for this knowledge barrier is have a knowledge base on the theories. We need to advance our knowledge in nursing. There should be a quest for knowledge. There should be debate surrounding theories. There should be a new worldview in nursing theory development. Next is conceptual barriers. There are conceptual blocks among nurses. They are not thinking. The nurses lack the experience about thinking of or considering about a new phenomena or considering a phenomena from a different perspective. So what can be done for this conceptual barrier is nurses need to be trained to observe, record, analyze and solve problems from different perspectives. Diversity in patients and their problems are a useful resource for theoretical development. And also there are barriers which is known as the research enterprise barrier. Evidence-based practice has disconnected nursing research from nursing theories. So now what can be done for these barriers is now nursing is emerging theoretically stronger. Use of theory in theoretical patient case studies is an example of this changing situation. Supportive environment must be provided by administrators to help the development of a theoretical culture through debates, discussions, and dialogues. Thus, theory development helps the nurse understand practice in a more complete and insightful way. Happy learning. Thank you.